the past recruitments have not upheld the standard and the criteria agreed upon by the people from the association and also the members. So what we see now is we're diverting from what's supposed to be called a standard, also to have a standard access to these civil service opportunities. We have a way where, depending on the people that are mandated to employ, they choose how they want to employ and also the criteria they want to use in those recruitments. It's also corruption. Corruption, we're not saying it has to involve money. No. When you employ people because they're politically inclined to a party, or you employ people because they're your relative, that's also corruption.
Hello and welcome to the Think Talk podcast. My name is Professor Wilbroad. I've been hosting this podcast for a while now, and where we have reached now, colleagues and friends, is that we would like to bring in a very important topic or series during this campaign period. And we are calling it Why Health is a Political Matter series. Now, you might say we are joining politics or not joining politics, but the thing is that we think health is a political discussion. And our political leaders who are jostling for power, wanting to come to power, must know what health challenges that the people of Zambia are facing. In order to do this, I promise to bring to you medical experts. And today we have got a guest, but also political leaders, the ones who are campaigning. Sometimes we would like to be on the ballot as doctors, but we don't have the time. We are in the hospital, we are in the operation theater. So even when you fall sick after something has happened to you in the political realm, you come to the hospital. So we can't all get out, but we have got things that we want to tell you today through our experts, through our political leadership, so that you yourself can also engage with them and ask them, are you going to solve these for me? Today, my special guest is no other than Dr. Chibwe. Welcome, Doc.
Thank you, Prof. Thank you. Indeed, this is a good platform and this is a good concept for the sector.
Excellent. So, Doc, we may not be on the ballot, but I think we have got the message to anyone who wants to come to political power, anyone who is engaged with this. And I want you to tell me, if you were woken up at night as an RDAZ president, maybe let's just talk about you. Maybe other people don't know about you. That would be a scandal, but let's hear. Who is Dr. Chibwe?
Well, I'm Paul Chibwe, orthopedic and trauma registrar, and I'm RDAZ president. RDAZ is well known for advocacy, and this is to do with medical education and also just advising on the health sector in the country.
Thank you very much, Dr. Chibwe. So you have got this mandate to advise and also to protect the well-being of the doctors. Thank you for the work that you do. We really appreciate it. Now, Dr. Chibwe, if I woke you up in the night, and I'll go back to that question, and I say, Doc, can you say 5 things that you think any political leader, anyone talking about going to parliament, anyone talking about going to State House must know about the state of the health? Can you tell me about 5 or 6 things, whatever is on your mind? I've just woken you up in the night. What are those?
Thank you, Prof. I think the first thing I would top of my head is health financing. It's under this issue where we sort out the insurance. Insurance is formed to help ordinary households to have that access to quality of health service that they desire. This means we cover the extreme age of our population. We cover an ordinary citizen who can't just wake up and go to a private facility and attend that CT scan that they want to do. Under the whole financing, again, we address the issue of external funding. I'm sure, Prof, you followed the issues surrounding the external funding, where we have the recent fallout government and US, where certain conditions didn't sit well with government, yet it's this sector that is able to bench the treatment of HIV, TB, and malaria control as well. We've attained major milestones towards this project, but then these, including the provision of ARVs, still bench on the external funding from the US and other funders, meaning this is practically an issue as well. The other issue that falls under health financing is the public-private partnership. I think we have a lot of countries that are doing well under this section. I can give an example of India, but in Zambia, I think we're still lagging behind. We have most of the private sector and the facilities are still holding on and still holding themselves without that much needed support from government. The other one that I would want to talk about, my favorite, of course, this is workforce. You know, Prof, I think this is something that as RDAZ we've really talked about, is if you want to maintain the quality and still uphold the quality of the health sector and the delivery that you give to the people of Zambia, the key is workforce, because you can still have a doctor set up a clinic in the bush at the mall, but then you can't have a facility without a doctor and without a clinic officer, without those nurses. So meaning workforce is something that's supposed to be addressed under the umbrella, of course, of unemployment rates in the country. The other key issue is drugs and consumables. You know, it's not every person, it's not every citizen who's able to go to a facility. We write a prescription and they're able to go to a pharmacy outside the facility and acquire those drugs. It's not everyone. So what we see now in these facilities, Prof, is you see a patient hypertensive, you prescribe the antihypertensives, yet they are unable to buy those simple drugs. What happens? They go home as though they were not seen by a doctor, because key to seeing a doctor is a treatment. Yet if you see a doctor, then you can't afford to buy those drugs, then you might as well just stay home. So we have a lot of patients that still come to the hospital, they seek opinion of a doctor. When we give them that opinion and treatment, they can't afford that treatment. They can't afford to maintain those drugs every day. What they do is they go back and they just come back with now extreme complications. And then the other thing, I think, is corruption. Corruption, I think we see stories from Zambia, and if you look at what's happening in the media, Prof, is you attend an interview and journalists will ask you, so who are the people stealing? Are they pharmacists? Are they doctors? But what we need to know is significance of corruption. So when you talk of drugs and consumables, isn't from a medical doctor or a pharmacist or any other practitioner stealing 2 tablets of Coartem. No. It's coming from when you have 15 containers diverting to a known location, or you have a compromise in the supply chain. I think that's a significant corruption that we're talking about. And we talk of recruitment. It's when you have the people that are holding the facility, the workforce that are holding the sector, despite working for free. Yet they are hopeful that in the subsequent recruitments they'll be employed. But what we've been seeing now is the past recruitments have not upheld the standard and the criteria agreed upon by the people from the association and also the members. So what we see now is we're diverting from what's supposed to be called a standard, also to have a standard access to these civil service opportunities. We have a way where, depending on the people that are mandated to employ, they choose how they want to employ, and also the criteria they want to use in those recruitments. It's also corruption. Corruption, we're not saying it has to involve money. No. When you employ people because they're politically inclined to a party, or you employ people because they're your relative, that's also corruption.
So, Doc, thank you very much for highlighting those important issues. So we'll go one at a time. So and we might not exhaust all of them, but let's just tap. And you remember, you are talking to the people of Zambia. You are talking to the politicians who want to come, and they are promising that they'll solve our problems. Let's begin something very close to your heart, which you have highlighted, the HR challenges. What should politicians know? What is the status of the HR challenges that Zambia faces today, and what do you want politicians to do about those?
Prof, we have a situation where a good number of people that are seeing patients are not supposed to be there. That's one issue. That's a threat to health sector, because if I'm seeing patients, yet I'm not supposed to be there. If I'm seeing patients, checking on my phone because anytime I can get a notification to deliver, some product that I'm selling so I can pay rent, that's a threat to healthcare. I think we need politicians that are speaking to how they're going to make sure the free labor, the volunteering that we're witnessing now should be addressed. It should be, should be given attention it needs at this moment. Meaning, this is to speak to the fact that we have a very big shortfall on the workforce. Take away, that's why multiple times when RDAZ stands toe-to-toe with ministry to pull out the free labor, they respond because they know the whole sector is limping, and that limping is being cushioned by the volunteering and the free labor that the sector is receiving from the nurses, from the medical officers, and also from the clinical officers, and just the other cadres of the profession.
So let me summarize what I'm understanding you are saying there. That the health system as it stands, it is using wrong people who are not employed, but they are volunteering and taking space to help. But basically, the system is depending on the people who are not supposed to be there. They are supposed to be at home.
Exactly.
Yes.
Exactly. Yeah.
So that is not sustainable.
No, it's not.
Okay, good. I hear. So we want our politicians to know the truth. The truth is that we have got a lot of volunteer doctors. And we're not saying some were not employed, some were employed, but we have got a lot. And also you are saying this, that even when we can't employ, we still have got inadequate numbers. We still need more doctors in the system. But we have got this irony: trained, not employed; vacancy, not occupied. And then you've got a system driven by volunteers. That's the status quo. Am I correct, or is something I'm missing?
You're correct, Prof. And the thing is, this is an emergency, Prof. But because it's being masked by the people that are volunteering, and that's why government, that's why even politicians can't give that eye that it deserves. But if you look at, if there was a situation where when people of Zambia, when citizens go to a facility, they come back not being seen because there was only one doctor to see them, or they stand in a queue for 2 days and they can't still be seen because there's only one doctor to be seen, then that will be seen as an emergency, and it will be treated with urgency that it deserves.
So this is a masked problem, and you want to unmask. So just say it in few words. Unmask this for someone who is jostling for power to say they will solve this problem. They could be in the current government or in whatever government form. Can you unmask the problem in a sentence or two?
Well, Prof, unmasking summary is what the people of Zambia have seen when we call for a tools down. And that's just for the doctors. Now imagine if all the cadres of profession that are the nurses, the physio, the environmental technicians, if all these people now down tools, just even for a day or so, then you would see the agency in what this issue is supposed to be treated with.
Excellent. Now I want to summarize because I want to move to the next pillar. So if you're a citizen listening to us, if you're a politician listening to us today from the RDAZ and the medical professional, we really want you to address the issue of HR. How would you deal with volunteer doctors? How would you deal with people who are not employed? How would you deal with the people who are coming from schools who are not, who are going to come to the workforce? And you remember, we have got a dilemma. We still need more doctors, but we can't employ them. The people still need these people. And we are saying, you as a politician, what would you do? And as you put up your manifestos, talk about this, please, this is what the medical fraternity is asking you to do. Can you find a solution to these issues? And we want to hold you accountable. Whatever you are going to say after you win, or even if whatever happened, you need to continue advocating. Your MPs for the people of Zambia, when they come, ask them, we have got volunteer doctors. If these moved out, what would you do? Let them find a solution for you. So we'll take a short break with Dr. Chibwe. And on the other side, I wanted to move on to the issue of drug supply. You mentioned corruption. And corruption is an interesting word because when you do medical training, you rarely hear about corruption, because I hear that doctors have stolen a drug or something. By the way, when I do medicine on the wards, I don't even see what drugs are there. So who is stealing? Where is the corruption? That's what we'll cover on the other side. Keep watching.